Okay, so I'm hoping that this is working correctly because I am a social media novice. So my name is Dr. Regina LaRocque. I live in Wellesley and I am a board member of Sustainable Wellesley. And I am here to kind of follow up a previous Facebook live stream that I did. Oh, good, it's working. I just got a prompt. A previous live stream that I did a couple days ago, mostly just with the aim of having a opportunity to have a conversation. So first, I just want to say who I am and who I am not. So I am an infectious disease doctor, and I've been doing that for more than 20 years. I'm also a researcher, and I study bacterial pathogens like cholera and others. And I am also a natural resources commissioner here in the town of Wellesley, and many of you know me in that capacity. And I am also a mother of two 13-year-old boys, and my husband is also a doctor specializing in infectious diseases. And so the information I'm giving you today is from all of those perspectives, and I am only representing myself and nobody else. But I would like to make myself available to answer some questions and provide some information. And I have another list of questions here in front of me, which is long, and some thoughts that I wanted to also convey. And so with all of that, I will get started. And so the first kind of area is how this, so I want to just start again by just giving a kind of 20,000 foot view of the situation that we are all dealing with together. And I just want to explain that this coronavirus that is causing an epidemic in the United States, particularly in our greater Boston area, this is a really special and concerning circumstance for us in the infectious disease world because this is a virus that has emerged from an animal reservoir, we call it, and has jumped into the human population. And we know that when events like that happen, they are of high concern. And let me explain to you a little bit about why that's of high concern. So it's very well known that viruses can live in animal communities and settings and really cause very minimal problems for the animals that are infected with them. But when those viruses get into human populations, it's a very different situation where there can be very severe disease and illness. I think we're all very familiar with the example of rabies. Rabies is kind of a similar situation where there's a virus that lives in animals like bats particularly, doesn't necessarily make them super sick, but when humans get exposed to rabies, it is a very deadly infection. And so that is, I think, a very commonly understood example of the scenario that we're looking at here, a virus that has jumped into the human population. So what's unique about this virus jumping into the human population is that it is a respiratory virus. So it is spread relatively easily between people. And that is what has allowed it to rapidly spread throughout the world, including to our own community here. And why is it spreading so rapidly? Well, one very important thing to understand here is that nobody in the human population of the entire world has any immunity to this virus. So that means that we are all susceptible to getting it. We are like newborn babies to this virus. And so we will all at some point get it. And that is what's happening here. And what does it mean for it to be a respiratory virus? So maybe I just need to step back and explain to everybody a little bit about how respiratory viruses spread. So we already know a lot about how respiratory viruses typically spread. I think many of us are familiar with our kind of typical example of a respiratory virus, which is influenza. And so respiratory viruses really spread by droplets. So humans who are infected in their upper airway Sneeze and cough. We have a tendency to sneeze and cough when we're infected with these viruses. When we sneeze and cough, we emit droplets. And I think many of us are familiar with the picture that we've seen of somebody sneezing and all of the material coming out of the droplets spreading out from their face. So those droplets are spread out from us when we sneeze and cough, and they can then descend and land on objects. And the other way people then get infected with respiratory viruses typically is by being close to somebody who's sneezing or coughing, and these droplets are breathed in or by you, or by touching material that has had the droplets land on them. And then you touch your face or your mouth and you transfer the virus to your self that way. Now, there is another way that this virus and other viruses also occasionally can spread, which is called by aerosol spread. And when there's aerosolization of a virus, that is an extra concerning situation where instead of the virus just being, or the organism just being on a little droplet, it has begun to waft through the air. And it can persist and waft through the air for many hours in a room. And that is something that seems to occur with this virus as well, that it can, in certain circumstances, become aerosolized. Now, from what we understand, this aerosolization is likely to occur in certain circumstances. For instance, when somebody is getting intubated, we worry about it when somebody's having the sample collected, when somebody's using a CPAP or BiPAP machine. So whenever you're manipulating their upper airway in some way, there is a potential for the virus to also become aerosolized. So that is an extra concern for healthcare workers. Obviously, if you have to intubate somebody emergently, the virus is aerosolized, and then it's very contagious. So I think that is just to give you a little bit of a background on how respiratory viruses spread. Now, there are data, and I just want to make an important point, which I made before, which is there's still a lot we don't know about this virus. And that is a circumstance which many of us are uncomfortable with, including those of us in the infectious disease world, because a lot of the recommendations that we put in place about how to protect healthcare workers, about how people should protect themselves, they require having some very basic knowledge of the biology of the organism. And, that's something which, because this has only recently emerged, we don't have. We are able to look back at other coronaviruses that have emerged in the past and think about what we learned from them. But there's a lot we don't know. And so it's, I think, discomforting for people to be in a position where sometimes these guidelines and recommendations change. And I think it's important to recognize that in some senses it's good when guidelines or recommendations are getting updated based on the science. That's what you want to have happening. But the reason that is happening is because a lot of information about the basic biology of this organism, this virus, we don't have yet, and we are only getting it. So that's one important point I wanted to make. I think another important point I just want people to have some insight and understanding into is kind of how our public health infrastructure works in the United States. I think we have for many years been fortunate to have not needed our public health infrastructure because we've had healthy populations. And I think most people don't kind of on a daily basis think about this a lot. And now suddenly we are in a situation where it's very different. So I just want to give a little thumbnail sketch of how our health infrastructure works in the United States. We are a very distributed system. We are not a top-down health infrastructure. So the CDC, which we're all paying a lot of attention to lately, issues guidance to state departments of public health, but they have no authority over the action of a given state's Department of Public Health. So really the state is the entity that is responsible for the health infrastructure within the state. And even downstream of the state Department of Public Health is our local boards of health, who really are responsible for health within a given community. And so the power and authority lies very much in the distributed local communities. And that's just a point that I want people to understand. The other thing is, I would just say that it's important to recognize that at this point we have been hit with a tidal wave, and that this tidal wave is happening now around us. And many of our existing infrastructures are doing their best to constitute themselves into a response. But I will say that a lot of that constituting into a response is occurring at the same time as we are trying to address the tidal wave. And so there are a lot of stresses and challenges on our healthcare system right now. And the biggest concern here is our healthcare system going to be able to withstand this tidal wave? And it is scary, because it is, I think, unclear if and how we will be able to deal with this large-scale epidemic that is happening. And the reason why this is important to appreciate is that a lot of people getting sick all at once puts stresses on a system. And I think we are already seeing that this system within our own communities is struggling to stay afloat, and we are still early on in the course of this epidemic. I think another thing I want to just make clear is that I know that there's confusion, and I think that it's a common entity when things are not clearly communicated, that people begin to have less trust. And so I do feel like one important piece of what needs to be occurring in the midst of all of this is regular good communication, so that people understand what's happening, understand what's being done in response, and trust that the leadership that's being offered is looking out for our best interests. And clearly, right now in Massachusetts, the person who is responsible for responding to this epidemic is our governor. And he is the person who is in charge. Okay, so I'm going to answer some questions here. So discuss what is known about how the illness is spread. So I think I talked about that, and I just wanted to kind of underscore the emergence of scientific data that is informing a little more about how this virus might spread. There was a recent piece in the New England Journal describing research done by some NIH researchers where they actually aerosolized the virus and then studied how long it survived on different types of surfaces: plastic, stainless steel, copper, cardboard. And, the message that is clear from that small study in the lab is that the aerosolized virus that lands on surfaces can survive for many hours and even days. And so this is important information, and I think ultimately it needs to inform some of the response. But in the short term, I think it is very important for people to understand that surfaces can be contaminated with the virus if it has been spewed onto that surface. So it kind of brings me back to something that I say to people a lot when I'm talking to them about how to protect themselves from infections. And I know it's a little crass, but if you're an infectious disease doctor, we like to think that the whole world is covered in a thin layer of poop. If you just think of the whole world as being covered in poop, anything you touch could be touching poop. Just think about it that way. And so that means that anything that you're coming into contact with, imagine in your head that it's covered with poop. So you want to clean and disinfect. And I think that this is another important issue for people to kind of get their head around. And I refer everybody to some of the resources on the CDC website about this. But I think disinfecting is really important. And it's not something that we normally do in our day-to-day lives. But you need to really think about having disinfecting agents available to you. You want to be sure they are EPA registered agents. Dilute household bleach is a good one. And it is entirely reasonable to be disinfecting anything that's coming into your home. That is the best way to be sure that it is free of virus. I know that a number of communities in Massachusetts have undertaken a challenge to have people get their food from takeout restaurants. And from a health perspective, that is a really bad idea because it's a common situation for outbreaks to be driven by what's called a point source, which is when a whole bunch of people do one thing. And if that one thing is infected or causes infection, then you suddenly have a lot of people who have an outbreak. And right now, in the midst of an epidemic, it's best for people to be not all doing the same thing. I think in our own Boston community, we know that the Biogen conference was really a kind of point source outbreak, right? One single location event where many people suddenly were infected and spread the virus to an entire community. So that's an important concept to understand. Can I get COVID-19 from touching or eating food that is contaminated? You know, I'm very much less worried about heated, cooked food than I am about the packaging that it is in. So I think it's best in general to, be limiting the packaging that you have hands-on interactions with, and that's why I have the concern about takeout. Any new data or analyses coming from China, Italy, or elsewhere that would provide insights into how we are responding to the disease? Well, I think that is the essential way that we are going to have insight into how we are going to be able to address this. And I think it's important for us to appreciate that the way this epidemic plays out is going to be different in different societies. And it is determined by what are the features of that given society and how that society is able to respond to the epidemic. So China is a country with a lot of top-down authority, and they exerted that in order to contain the virus. And frankly, at this point, there are no new cases that originated in China being reported there, and that is a big transition. We live in a different kind of society that is not a top-down society, and so what do our societies have to muster to the response here? That's an important component of this. I do believe that we have not, from a higher level, conveyed to the public often and repeatedly enough the gravity of this threat such that they were prepared to the maximal possible means. I think if you look at what has taken place in societies like Singapore, where they were aware after the last coronavirus outbreak that that was a red flag for the possibility of another similar event emerging, and they instituted some very strict and very well-funded public health capacity and infrastructure to be prepared for another pandemic event like that, another emergence like that. And so some of the tools that have been used by countries in Asia, these include things like surveillance using people's cell phones. We don't have access to in our country for very important reasons, but they also limit our ability to track and understand who's been interacting with whom. So that's why the very basic kind of public health response that we are all participating in now, isolating from each other, is very important. And we have to depend on our political leaders in our country to take strong action to protect all of us. And the sooner action is taken, the more effective it is. That is the bottom line with any event that is occurring in an exponential fashion. Every day, the numbers double or triple. So the earlier you take action, the more impact they have. Another point I want to underscore to people, and I said it before, is that this is a disease for which we do not have any treatment and we do not have any vaccine. And those are typically the tools that we bring to bear when we have illnesses, and we're all accustomed to that. But we do not have that in this scenario. And so that means that we have to engage in the strongest possible fashion in the public health measures that are available to us. And I think that's very important to understand. Here in Boston, we have a lot of resources in terms of science and research, but those are not they're not going to save us from what's happening in the moment. Those are things that take time to bring to fruition, and that's an important thing for people to understand. I think another question that has come up a lot is related to testing. And I think I just also want to underscore a couple of things related to that, which is at this point, the numbers that you see emerging, that we see emerging, really don't mean anything because they are outdated, they are incomplete, and they really, at this point, don't have meaningful information to give us about the course of the epidemic. We have to go with what is being seen on the ground. And what is being seen on the ground is lots of people with respiratory illness presenting to hospital settings, and people in hospitals with very severe disease due to this respiratory virus. And when you see that, you know that that is the tip of the iceberg. The people that are sick are the very tip, and that underneath that are many people who are less sick, but in whom the virus is circulating. There's a concept in infectious diseases or kind of environmental epidemiology called the canary in the coal mine. And so when some of those people begin to get sick, people who have compromised immune systems or are very old, they're the first people to get sick. And those are the signs that the infection is circulating. When those kinds of people, the canaries in the coal mine, are getting sick. Another important misconception I've seen, or misunderstanding, is the notion that young children don't get sick with this. And of course, that is reassuring in many senses, that the experience in other countries has been that, in general, the younger people are, the less likely they are to be severely ill. But it's a really important distinction to make, that doesn't mean that there won't be kids who die. There have been young kids who have died with this, particularly children who are under the age of 1. But there are many described cases of teenagers who have died, otherwise healthy adults who have died. And so even though the percent of that population is small, when everybody gets infected at the same time, 1% of that population dying from an illness is a lot of people. And the problem that we have is that we are up against a healthcare capacity crunch. And if you have thousands of people, as we likely are going to have, thousands of people suddenly getting desperately ill and needing ventilators and needing high-level ICU care, we don't have enough of that to offer. And that's when things begin to get very uncomfortable for healthcare workers. And these are conversations that are beginning to take place among some of the professional societies. And it's awful to imagine that we will have to come up with ideas of how we are going to triage who lives and who dies. And it makes my stomach turn having to think about that. And these are the kinds of conversations that professional societies are having in the moment, in Washington and other places, because there will be resource limitations. And so I really encourage people, actually, it sounds rather morbid in a way, but to really think through what it would mean to get critically ill suddenly and what you would want to have happen in those circumstances. I think particularly these are conversations which, as a society, I think we have generally not done a very good job of being honest with, older people about talking to them in advance of an illness, what you would like to have done. And these are important conversations for anybody to be having with their family members. But I'm afraid there's a little more urgency to it now, and it's important to maybe have those conversations, because I think for many people who are of a certain age, they have already made decisions about how they would like to be treated in times of great medical illness. And so it's important to maybe think that through sooner rather than later. Social distancing. I guess I just want to underscore that it's like the activities that we are taking now to separate ourselves are really to protect everybody. They're to protect ourselves. They're to protect our healthcare workforce. They are to protect having hospitals available for the purposes we need them for. And so it is essential that people engage in the restrictions that have been put out. And, I encourage all of us to take a really good, hard look at the leadership we have and make sure we are being clear to them that we expect the most urgent, the most immediate, and the most informed response from them in our own state, because I believe that our state governors now really have to be the ones taking the lead. I think a lot of people have been asking about masks, or asking me about masks, and I just want to share kind of a perspective on that. A lot of the early messaging about masks, first of all, it came at a time when we did not have a lot of coronavirus circulating in the U.S., and so the purpose then was to really ensure that people were not running out and hoarding a needed medical supply when it wasn't necessary. Now that has come to fruition because we are facing a shortage of masks for healthcare workers. So we don't want people who don't need masks to be wearing them and taking them away from healthcare workers. So that is clearly a component of things. And at this point, I don't think it's likely one would find masks in kind of general settings because we are undersupplied. Now, there's a separate question. If somebody wants to make their own mask and wear it, I think of everything as a risk-benefit, right? So is there any risk to anybody, a person making and wearing their own mask? Well, no, there's no risk to that. Is there a benefit? Well, I think we know less about whether there's a benefit. It might stop you from touching your face, which is valuable. It might prevent transmission from you to other people. So I think that's a different, rubric of decision making. As long as a mask is not taking away from those who need it, I have no problem with the notion of people wearing a mask. I do think it's important to underscore that for many years, people in Asia, we have observed, have commonly worn masks when traveling or when out and about. And I think this is a habit that has evolved in countries where air pollution rates were higher, other kind of social, cultural drivers of mask wearing. So there's many other reasons why people sometimes wear masks. And I just want to put that out there. Wellesley has closed athletic fields, playgrounds, and tennis courts. Is this really necessary? Well, I just want to share from my perspective as a healthcare worker Everything everybody does to not get sick right now matters. I'm actually thinking you don't want to break your leg right now. You don't want to poke yourself in the eye. You don't want to get food poisoning. You don't want to be putting any demands on the healthcare resources that we have, because they are stretched thin, and they will be even more stretched thin in the coming days. So I fully support anything we do from the bottom up to maximize separation of people and prevention of disease. I think those are the things I had on my list to talk about. I'm just looking at the question. Do I feel that the state of Massachusetts should follow the stay-at-home order that other states have? Well, I just want to underscore that any action you take on the front of preventing the spread of coronavirus, the sooner you take it, the better it's going to be to do. I think it is pretty clear from the trajectory that we're looking at that we are still about a week behind where they were in Italy. And where they are in Italy is frightening. And so at this point, it's important for everybody to understand that the decision making about what we do in Massachusetts is driven by our political leaders. Governor Baker is in charge of our state's response. And so I anticipate and hope and expect that his decision making is informed by the absolute best science and top-notch public health expertise that he has available to him. That is my expectation, and it should be the expectation of everybody in our communities. And so I just encourage everybody to take a look and decide and understand about how the decision-making process happens. We in the hospitals, those of us who are scientists, it is our responsibility to talk about what we see going on, to explain it, but we do not have the power or the authority to respond. That power and authority is invested in our political leadership. And I'll just make clear that those of us who are in the healthcare community are concerned. And there's many concerning things happening here already. And we need to constitute a response, a proactive response to this at the same time as many of our healthcare systems are scrambling to be reactive to what's going on the ground. And that's a tight spot to be in. With an epidemic like this, what typically occurs is that there is increasing number of sick people in the hospital. The hospitals themselves become a central point for further spread of the epidemic because you have concentrated in one place a lot of people who are very sick. And healthcare workers are at risk themselves and also at risk of spreading disease to the community. So there's a lot of very careful actions that have to be taken within hospitals, and there's a lot of resources needed to keep your hospitals safe and running. So again, I just want to underscore some questions about testing. Do you have any update on our ability to test people in Massachusetts? Well, this has been, frankly, one of the areas where, we have failed to be prepared for this, because I think ideally we would have had in place a capacity to broadly screen and test many people proactively before the virus arrived. And so we would have known immediately when it did. But for a variety of reasons, that was not the case. And so I know that there are immense efforts underway to increase the number of people being tested. That those data need to inform the response, and they need to be systematically kind of collected and fed into decision makers. But unfortunately, kind of at the same time as the cases are rolling in, the tests are rolling out. And so, again, just to underscore that the numbers consequently have little kind of real meaning, because in order for the numbers to have meaning, you had to have in place a consistent denominator, a consistent understanding of how many people were being tested and how many people were positive. And that is very much in transition right now. So what is important to keep our eye on is that we have cases, we have people in the hospital who are sick, and they are the tip of the iceberg. Even in our own community, I think we have 7 or 8 people who have made their way through the pipeline of how you get tested, and they have returned positive. And I think we know that then means that we have sufficient circulating virus in our own community that we need to be concerned and take action. Okay, so I think that I'm going to end here. And I just want to say one thing. As the Natural Resources Commissioner in the town, I think in an interesting way, I have an extra appreciation for our town's natural resources, because one of the places where it has been, I think, acceptable and appropriate to be out and about is within parks and trails. And we are very fortunate in our community to have access to things like that. And this is an extra value that they have for us in times like this. I want to also underscore my immense concern for people who are more vulnerable. I include in that older individuals, people who are forced to live in congregate settings by virtue of choice or not choice. I worry about immigrant communities in our state who I think already fear accessing medical care in the best of times and live in more congregate settings, and so are at high risk in this epidemic. And so I think it's really important for us to think about how do we do the things we need to do to protect people who are most vulnerable. And in that population, I include healthcare workers, because the people who are going to be on the front line taking care of sick individuals are at highest risk too. Okay, so I will stop there, and I'm happy to do this again if it's helpful. I feel mostly that I'm just kind of conveying some information from a local source, and I just want to again end by saying that I am representing myself. I am an infectious disease specialist, and it is very important to seek out reliable, trustworthy sources of information. And I do think that our local Board of Health is an important source of information, our state Department of Public Health, the CDC. These are reliable sources of information. But the Boston Globe is another one. And the New York Times, I think, has been doing an outstanding job over the last weeks to months of covering this epidemic, this pandemic. And so I refer you to all of those sources. Okay, so I'm going to stop there, but thank you everybody for listening.